inhalation and expiration. Okay. Strong muscle tone below the umbilicus, no signs of weakening or atrophy at the muscle there, which is good. So just going to feel along the lower quadrant here. Any signs of distension at the bladder, which is not notable. Hi Brittany.
Hi.
Welcome back to the office. It's nice to have you this evening. So today I have you in for a dedicated abdominal assessment. So we are going to be going through a thorough abdominal exam, looking over your abdomen, obviously having a look for any abnormal signs of distension or swelling, any pockets of edema or abnormal fluids, any abnormalities in the skin color, skin texture, that kind of thing. I'll be palpating for your organs, taking some measurements, and just having an overall look to make sure everything's functioning okay. All right. Do you have any specific concerns today?
No.
Okay, very good. So just going to check to make sure everything's functioning okay, and then I'll have you on your way.
Okay.
All right, let's go ahead and get right in. All right, so just starting with a visual inspection, I'm going to use my Penlight to have a look over your skin. So external inspection here, looking for any abnormal lesions or abrasions of the skin. Nothing notable thus far. I see a small, what looks like a little mole here. You also have a freckle there. No outward signs of distension at the umbilicus. So I'm just going to visualize your abdominal rise and fall upon respiration here. So just watching as you take breaths, looking for normal inhalation and expiration. So having a look over the umbilicus, not noting any abnormalities there, no signs of umbilical hernia or distension. Now, of course, I will palpate further there. Okay. Just gonna lower this slightly so I can have a look at the pelvic bone. So just looking for symmetry here, any signs of abnormality at the hip. Very good. Okay. So initial physical inspection looks okay. I don't note anything particularly abnormal. Just go ahead and put my gloves on so I can start a palpatory assessment. So allow me just a second. Okay. All right, so you're just going to feel me palpate around with my hands, just starting here at the top of the rib cage. So just the lower breastbone, feeling for any abnormality at the chest wall. And just going to palpate across, feeling for any signs of abnormalities bilaterally. Along the rib cage, superficial palpation of the organs. Abdomen is just a bit cold to the touch, but nothing that I would say is significant. Bit of a deeper palpation here, palpating for your organs, feeling for any signs of abnormal distension or edema. Just palpate below, feeling for the kidneys. Kidneys are not typically palpable if they are healthy, and I'm not feeling anything today, so that's a good sign. Also going to feel around the umbilicus, feeling around your belly button for any signs of distension. It's typically where we see abdominal hernia below the umbilical line here, so just feeling for that. Okay, very good. Alright, so I'm going to go ahead and do an auscultation assessment. So just having listened with my stethoscope, I want to make sure that I'm not missing anything internally that could be misaligned, any signs of indigestion or improper circulation. So this is very cold. Have you just breathe normally for me to start? Very good. So far hearing normal respiration, no sounds of occlusion at the frontal lung. Very normal digestion. No signs of occlusion at the intestine. Bowel sounds are active. I'm going to listen directly over the umbilicus, listening for any signs of circulatory dysfunction. Okay. Listening just below the chest wall here. If I could have you breathe in deep for me. Very good. Go ahead and release. And one more time. And go ahead and release. Very good. So I'm just going to listen at the pelvic bone here, listening at the femoral artery. Good. Okay, very good. So not hearing anything abnormal here. Circulation is equal bilaterally. So just going to follow that up with some percussion. So you're just going to feel a light tapping. Very good. So your stethoscope assessment was well within normal limits. No issues there. Now, since I have my percussive tool out, I'll go ahead and follow up with my normal abdominal percussion here. So just tapping along the bony prominence, listening for any shallowness or any signs of hollowness here. Percussing at the sternum. Okay. Alright, so just going to follow that up with a couple of measurements here. So measuring both for symmetry and just to get an accurate gauge of your overall abdominal measurement. So right at about the left breastbone to pelvic bone, we're about 8 inches. Even symmetrically there. And about the same at the left ribcage. Maybe slightly higher at the right side. It's about 5 inches from sternum to umbilicus and about 3 inches below, which is fairly symmetrical in comparison to lateral measurement there, so that's very good. So just a secondary measurement for symmetry here. This tool is very, very cold, so I do apologize. I'm just going to measure at the rib cage. Even there. Just going to measure at the base of the pelvic bone. The lower abdominal quadrant here is midline. And umbilical distance is about 1/3. So I'm going to have you take a deep breath in for me. Good, and go ahead and release. And we'll do that one more time. Very good, and go ahead and release. Very good. So very even inhalation there. That's great. Just measuring curvature here. going to allow me to measure the curvature of your rib cage here. So just about a third there. About a quarter inch at first quadrant and even over the umbilicus, which is good. So just going to measure comparatively at the pelvic bone here. That looks okay. Spatial symmetry there is good. Okay. Very good. Okay. So abdominal measurements are very symmetrical. No signs of asymmetry, no signs of distension at the bony prominence, which is a very good sign. So I'm just going to take my thermometer gun. This is going to allow me to test for an average body temperature at the abdomen now. Mainly using this to test for any areas of excess warmth. Anything that could indicate a sign of infection or inflammation. So specifically testing the lower quadrants around your organs. So that was for external testing for infection. If there are any areas that are particularly warm, then that can be concerning. So just make sure we test a couple different places here. Directly at the sternum. Abdomen is actually a little cold. It is fairly chilly in the room, so that is okay. And of course, directly over the umbilicus, looking for any signs of distension or inflammation there. Okay, so average temperature of the abdomen is about 97.2. So slightly on the chilly side, but nothing overtly concerning. We're going to move on to our secondary palpation. So I'm just going to apply a flat, gentle pressure, starting at left quadrant 1. So not feeling anything particularly concerning here. Moving on to right quadrant 1. Left quadrant 2, which is the lower quadrant, so slightly firmer palpation here. Just going to apply a gentle circular pressure, so will allow me to manipulate any possible fluid buildup here. So just feeling around there, nothing notable. And right quadrant 2, same thing, flat palpation to start. Nothing particularly notable there. So just going to feel at the midline, starting at the chest wall, so feeling along the sternum and flat palpation down center abdomen here. Strong muscle tone below the umbilicus, no signs of weakening or atrophy at the muscle there, which is good. So just going to feel along the lower quadrant here. Any signs of distension at the bladder, which is not notable. Okay. So I'm just going to do some slight manipulation at the skin, so looking for any abnormality in skin texture. See one small freckle here. It's not raised above the surface of the skin. Very circular and symmetrical, no signs of abnormal border or no blackening or abnormal discoloration. So that's a very good indication that this is not concerning. Very small one here as well. One very small mole here, does slightly raised above the skin, but it is even and symmetrical in shape and color. Very gently pulling at the skin, looking for anything underlying here. Closer look at the texture is fairly clear. Very good there. Let's say your external examination is okay. I want to go ahead and test a couple more things here. So I'm going to do a test initially for your abdominal reflex. Now you have muscles in your abdomen that allow you to flex with certain stimuli applied to the skin. So for this first portion, you don't have to respond with anything significant. I'm just looking for a natural reaction here. So I'm going to use just a soft facial tissue. So just testing for your natural muscle reflex. Apologize if this is a little ticklish. Okay. So far, very healthy, responsive muscle tone. Same thing this time. I'm just going to test with very, very cold objects, so it might be slightly alarming. Just try to relax for me. Just looking for that natural reaction here. Abdominal reflex response bilaterally here at the rib cage. Very good. Okay. So just going to follow a little bit the test for sharp response. This is a very sharp tool. Again, testing that bilateral reflex response here. Now, so now I'm going to do a brief test for sensory perception. Now, sensory perception and neurological response are slightly different. For this one, I would like you to please indicate if and when you feel something. So the first thing you're going to feel, just to demonstrate here, is a very soft sensation. So you can either verbalize with a yes or just shake your head yes if you feel it, okay? Yes. Yes. Okay. Now, same thing with the cold. Yes. 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 Soft. Soft. Sharp. Sharp. Soft. Sharp. Soft. Soft. Sharp. Soft.
Sharp. Sharp. Soft. Sharp. Sharp.
Okay, good. Just one anomaly there, but you did correct it, so that's okay. Now I want you to try to indicate between cold sensation and warm. Can you feel that this is warmer?
Yes.
Okay.
Cold. Warm. Warm. Cold. Warm. Cold. 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 Warm. Warm. Cold. Cold. Cold.
Very good. Now lastly, for sensation response, can you just tell me if this here feels the same as this?
Yes.
And does this feel the same as this?
Yes.
And here and here,
Yes.
and here and here.
Yes.
No areas that feel numb or any tingling sensations, anything like that?
No.
Very good. Okay. All right. Okay, so to close out your examination, I'm just going to have a last look here. I'm just going to use my penlight to visualize the umbilicus internally, looking for any abnormality and debris or discoloration there. Just not notable. So hair growth is normal, even in direction and color. Just having a look at the overall posture and alignment in correlation with the hip bone. So shoulder placement is midline to ribs, parallel with pelvic bone. Okay, so no specific issues there. And your palpatory assessment was normal, no signs of inflammation or distension at the abdomen. So I would say you're okay for today, Brittany. I didn't notice anything abnormal in your abdominal region. There was nothing that I would say is concerning. Your auscultation assessment was normal digestive sounds. It does sound like you might be hungry. Your stomach is growling just a little. Obviously, that is normal. But I did hear normal digestion and bowel sounds are fairly active. So that is very good. So I will go ahead and adjust your clothing. So I have quite a few notes to input as far as your appointment goes today. All of this information will be added to your patient portal so you can view it if you please. And if there are no questions for me today, I would say you are good to go for your annual assessment. Okay?
Thank you.
All right. Thank you very much. I hope you have a good day and get home safely.